Gonzalez, and the purpose of this presentation is to explain what norovirus is, how it's transmitted, signs, symptoms, treatment, and prognosis. We are going to start defining what norovirus is. As the name says, it's a virus. The norovirus are members of a group of viruses called caliciviruses. Norovirus infection is the most common cause of gastroenteritis in the United States and is also known as a norovirus or winter vomiting disease. The name came from the place of the first outbreak, and the place is Norwalk, Ohio. The transmission of this virus mainly occurs via the fecal-oral and vomit-oral route. This is a particular route of transmission where the pathogen in fecal particles pass from one person to the mouth of other person. This can be by a vomite. This happens due to touching a contaminated surface or drinking contaminated water, and also eating raw food, uncooked food, especially spinach, lettuce, leaf green, and shellfish food. One characteristic of this virus is that it's highly contagious. Very small amount of virus can cause an infection. Less than 10 viral particles need to be infected. And stool and vomit can have billions of particles, so it's really easy to get infected. Even if the person is better or without symptoms, is shit in a stool for approximately 4 weeks or months. It's also a really stable virus. Can survive in the environment and can receive up to 60 degrees. And is also resistant to ethanol or alcohol. When a person becomes infected with norovirus, the particle begins to replicate in the small intestine. For this reason, most of the symptoms are developed between 12 and 48 hours after exposure to start showing symptoms. Norovirus causes a gastroenteritis. This means an inflammation of the stomach and small and large intestine. This affects directly the gastrointestinal tract. And how affect is decreasing gastroemptying. This causes vomiting and diarrhea. Also causes malabsorption by affecting the intestine mucosa. This means that we can absorb phosphorus, fat, and other minerals. Signs and symptoms. Some symptoms are abdominal pain, vomiting, watery diarrhea, and fever. This virus causes more vomiting than diarrhea. Other symptoms include myalgias, headaches, and fatigue. Myalgias mean muscle pain, and the symptoms last for 48 to 72 hours. How to diagnose the norovirus? Usually, they do a clinical diagnosis by the symptoms of the patient. If it's a patient, elderly, a kid, or immunocompromised patient, they are going to do a stool sample just to be sure that it's the virus and not something else. Treatment. There is no treatment or vaccine for norovirus, and the reason is because even if you get norovirus, you are never going to get immunity to the virus, so there is no reason to create a vaccine. And the norovirus infection clears up on its own in a few days, so it is not fatal. However, norovirus can present complications in infant, elderly, and immunosuppressed patients because a large amount of secrete diarrhea can cause dehydration. To avoid dehydration, the patient needs to drink plenty of liquid. But if the patient presents dehydration, maybe it's possible to use an IV. As we know, hand washing is the single most effective way to prevent the spread of infection and virus. For this virus, because it's really resistible, we need to use soap and water because gel sanitizer is not going to kill the virus. And to clean the surface, we need to use bleach. The prognosis for this virus is very positive. In most cases, after 3 days, the patient will feel better without any major care such as medication or hospitalization. However, some people may have complications due to dehydration. And also the possibility of a new infection will always be present since the patient infected with the virus do not create immunity after acquiring it. Thank you.